All right, so what we're looking at is the foot of a truck driver here who gets this really painful callousing on the inside of his first MTPJ, or the bunion joint. And now this is a little bit more than what it actually looks. So if you can see, we take off that callus cap, and underneath there you can see there's this really thick line of callus where the skin gets pinched. Now, unfortunately, he has this crease in his skin. So we know that when we get a tyloma, it's when we pinch the skin, and the ridge of the pinch is where there's more pressure. So this is working in the opposite direction. So his skin's folding inwards, and he's getting a callousing in the depression, or in the crevice of the where the skin's pinching. So it gets really, really painful. It feels like he's walking on a stone. This comes back he comes to see me about twice a year for this one. So we just have to go in there really carefully, get right to the bottom of it, and just follow the landscape or the contours of that pinching, and remove all that hard skin. Now, of course, we get him in a shoe that can accommodate this, cushion his foot up, and make sure there's enough room, depth and width wise, and also have an arch support to take some of the pressure in the arch rather than right on this area. That's helped. We used to have to see this one every sort of 6 to 8 weeks, but now we've got it out to twice a year. But that seems to be about the limit of what we can do without doing any sort of surgery on the bunion joint, which is not interested in entertaining any surgery at all. So we'll just continue to do this a couple of times a year, just to keep him pain-free and remove as much of this as we can. Now, these can form pretty much anywhere on the body where there's a fold, but this is probably the most common spot where we get this type of sort of folding or tyloma on the foot. But it's not typically called a tyloma, it's more just a calloused depression. So that's what we do. Have a little bit of the rubbing alcohol just to see and feel that, make sure there's nothing still in there, and we've gotten as much out as we can, because we want this to last as long as we can, because the more we take out, the longer it lasts. But we just want to make sure we don't make it uncomfortable, because it's kind of the exact opposite to what we're actually trying to do. So to bridle all that out, make sure there's nothing left in there, feel that it's all nice and smooth, and then use some moisturizer on this every day. We usually use something like a 10 to 15% urea moisturizer, just to help to soften the skin, and it makes it just feel better as it grows back, and it also makes it easier to remove for the next time. So that's a close-up view of it. You can see we've got all that out. You can see there's depression like a cut in there now, and we'll see this go in about 6 months' time.